All right, so hi everyone. My name is Lita Buttolph, and I'm a postdoctoral research fellow here at NUNM in the Health Got Research Institute. And I'm part of what is called the R90 Bridge program. And this is a program funded by the National Institutes of Health, the National Center for Complementary and Integrative Health. Bridge stands for Building Research Across Interdisciplinary Gaps, and it's a training program, a 3-year training program to teach people to become integrative medicine researchers. Yeah. Should I? Okay. I'm going to share my screen now so you can see the slideshow. Okay. And today I'm going to be talking about several research studies that I've done looking at QiGong for people with multiple sclerosis. I just want to give you a little background about myself. I've had a very windy career path, but it's always been linked to this love of nature that I've had. So for my undergraduate studies, I studied biology with a focus on ecology. And then I did a master's. I was interested in nature, but I was also interested in how humans interact with nature. So I did a master's, and it was a forestry program, but it was focusing on rangeland systems. And those are both at UC Berkeley. And then I did a PhD in rangeland ecology and range management at Utah State University, where I was able to do research in Bolivia, and I lived in Bolivia for 2 years. This is just a quick slideshow of me in Bolivia. My thesis was understanding the impacts of a United Nations program on alpaca and llama herders living in the Bolivian Andes. So when I finished my PhD, I moved to Portland, and I started working at various nonprofits, doing sustainable development and research in community well-being. But I also, at the same time, when I moved to Portland, I met these 2 women. I don't know if you can see my cursor. These 2 women, Catherine Langstaff and Ann Baker, who were starting a Wild Goose Qigong class. And I had studied a little Tai Chi when I was doing my PhD, and I thought it was great. But when I started practicing the Wild Goose Qigong, within about a month or so of my practice, it really transformed my health. I was like, oh my gosh, I'm not really doing anything, and yet I'm feeling so much better. So there was something very interesting about Qigong for me. And then over time, I started to be an assistant teacher, and then I did a teacher training program with our teacher in the center here. That's Grandmaster Hui Liu. She was living in the San Francisco Bay Area, and so she was a student of the woman on the far end, who is Grandmaster Yang Mei Jun, who was the 27th inheritor of the Wild Goose Qigong form. Grandmaster Yang lived to 108. She had all sorts of amazing powers. You can see a little light in the corner there. That's her chi. Anyway, Qigong really changed my life. It changed my health. It really has affected me in so many different ways. During my teacher training program, I started to learn a little bit about traditional Chinese medicine theory. And I got really excited about it, but then thought, I can't go back to school. I already have a PhD. So I put that off for a while, but the thought continued. And so I eventually enrolled here at NUNM in their classical Chinese medicine program, and also did my master's in integrative medicine research, just because I continue to love research. So just a little background on Qigong, if you're not familiar with what Qigong is. So Qigong is this ancient Chinese movement art that was developed to preserve physical, mental, and spiritual health. It's originated, they think, sometime between 5,000 and 10,000 years ago. And it was first referenced in written form about 4,000 years ago. And the Chinese character on top is the character for qi, which can be translated as breath or vital life force or energy. but it also can be translated as this pressurization. The little star-looking symbol in the middle is a translation of a grain of rice. So you can think about this pot pressurizing this rice and creating this vitality. And the character on the bottom is gong, which is can mean work or practice or cultivation. So qigong is the cultivation of one's life force or energy. And is considered an important component of traditional Chinese medicine. And then it's thought that illness occurs when the flow of qi in the body is blocked or disturbed somehow. And so qigong works by opening up any blockages and maintaining sort of the smooth and balanced flow of qi throughout the body through physical movements, as well as meditative movements, as well as visualization. Most people are familiar with Tai Chi here in the United States. So Tai Chi is considered a subtype of Qigong with a martial art component. So because it has this sort of martial art fighting component, a lot of the Tai Chi movements are more upright. You don't bend over because you're vulnerable to your enemy if you're in a more compromised position. So Tai Chi movements tend to be more upright. They tend to be longer forms. And so when I talk about Qigong today, I will also be encompassing Tai Chi in that definition. So I was particularly interested in the effects of Qigong on neurological conditions. So I've been a Qigong instructor now almost 20 years, and I worked with some students that had severe neurological conditions, ALS and multiple system atrophy. And the Qigong didn't cure their conditions, but it really played a really important role in their quality of life, I would say. So I was really interested in how this Qigong works for neurological conditions. There's been a lot of research done on Parkinson's, but there wasn't as much research done on multiple sclerosis. And that's how I came to study Qigong for MS. So just some background about MS. It's an autoimmune disorder where the body attacks, the immune cells of the body attack the myelin sheath that surrounds the nerve cells of the body. It affects about 1 million people in the United States and is the leading cause of disability among young adults. So some of the symptoms of MS can include fatigue, muscle spasm, spasticity, pain, bladder and bowel dysfunction, cognitive decline, and anxiety and depression. So for my master's thesis and doctoral thesis here at NUNM, I decided to conduct a feasibility study for people with MS, and I would have them attend public classes in the community, public Qigong classes. My decision to do this was primarily because I didn't have any funding to pay for a Qigong instructor, but I also thought it would be a better reflection of how people with MS might come to practice Qigong in the real world. So the goals were to assess the feasibility of this pragmatic trial, and then also start to look at any potential benefits that people might experience, such as balance, walking ability, and quality of life. So the design of the study, I recruited 20 people with MS. They had to be able to walk at least 50 feet without any assistance. And they were randomized either to a Qigong group where they attended Qigong classes once a week for 12 weeks, and then they were encouraged to practice at home 10 minutes every day. And then there was a waitlist control. And so those people just carried on with their lives. And then after 12 weeks, they had the option of joining a 12-week Qigong course. And I was interested in looking at feasibility. So that included recruitment. How easy was it to recruit people? Retention, would people stay in the study? Adherence, do people show up to class? Do they do the home practice? And ability to participate in the Qigong classes. And then I had some exploratory measures looking at physical function like walking and balance and gait, as well as some questionnaires asking people about their health. Yeah. Yes, they had to be stable on their medication. So they were allowed to have medications, but they weren't allowed to have had it changed in the last 3 months or something. Yeah. So these are the results that I got. So we were able to recruit people. People attended the classes. They were able to participate. But the one thing that didn't meet our expectations was the retention. We lost about 40% of our participants. So that was interesting. And then I know this is too small to really see, but these are just the outcome measures that we collected, and there weren't any significant differences between the QiGong and the control group. There was one significant difference on top that shows this is the time 25-foot walk, but actually the control group actually had better walking ability after the 12 weeks in the QiGong group. So I feel like that these results, it's okay that they're negative results. And so it made me think about things a little more. So in order to understand these results, we asked participants to complete an exit survey, either when they finished the study or when they discontinued the study. And so we were particularly interested in getting the perspectives of people who dropped out just to better understand some of the challenges that they were experiencing. So these are just some of the quotes. So people reported perceived benefits. Some people learned more about QiGong. They felt like they slept better. They felt more centered and energized. I really love this bottom one. It says, my negative inner voices have lessened. I'm noticeably less depressed and less dragged down by mental issues. Physically, I'm able to stand, walk, run, carry things. In fact, do all physical activities better and longer without trouble or needing help. And then some of the challenges, some of them were physical challenges, like, some of the movements were uncomfortable or created some pain. One person started to have spasticity that had gotten worse, but she had also discontinued a daily yoga practice that she had, which we weren't aware of at the time. And then this bottom quote, I think, was also really valuable. This person says, the one class I attended was physically and emotionally uncomfortable. I didn't feel like the instructor gave enough explanation of modifications. The room was hot, and I was uncomfortable with many others in the class without MS who are more advanced in QiGong. So based on these results, it helps me to realize that QiGong is a really complex intervention, and there are thousands of styles and lineages, and they vary in their level of complexity and their level of activity. And so the style and the type of QiGong may play an important role in how accessible it is, and how acceptable and how efficacious it might be for people. Also important was this whole environment around the learning, the class environment. So that could also influence how well people benefited from this practice. So I finished my degrees, and then a couple years later, I started the bridge program that I'm currently in now. And I decided to revisit my research on QiGong for MS. But now I had some new information. So the National Institutes of Health have something called a stage model for behavioral interventions. And these are 6 different stages of different types of research that you can focus on when you're doing a behavioral intervention. So stage 0, which is over there, it's a little hard to see, is just basic science research. Stage 1 is developing an intervention, refining an intervention. Stage 2 is testing how effective it is in a very controlled environment. Stage 3 is testing in a controlled environment, but in a community setting. And then stage 4 is looking at effectiveness. So how does this play out in the real world without all these factors that are controlled? And then the final stage is implementation and dissemination. And that's how do we spread this to a broader audience? So for my master's, I realized I started in stage 4. I was already looking at effectiveness. There was no control. And what I really needed to do was go back to stage 1 and really start to look at the intervention, maybe refine it, start to create a protocol that might be more suitable for people with MS or any other level of disability. So the next study I did was to conduct a survey of experts. So these were clinicians, researchers, and instructors who had experience with QiGong as well as MS. So the aims of this study were to identify what QiGong forms of movements would be feasible and safe and effective in improving symptoms for MS, identify what factors related to the classroom environment help make it feasible, safe, and effective, and then as well as other factors. If I were to conduct another clinical trial, what other things are important? So to be eligible to be in the study, you had to have at least 5 years of experience teaching QiGong or researching QiGong, and that could include Tai Chi as well as any other movement therapy. Or you had to have 5 or more years of clinical practice that involves some sort of QiGong, Tai Chi, or other movement therapy, and have worked with at least 3 people with MS, as well as be able to provide informed consent, to read and write in English, and complete the surveys online. So what we were interested again was just collecting opinions about QiGong forms, key factors for the learning environment, and then opinions about the proper dosing, like how many times a week do you practice, how long, instructor qualifications, and then what kind of modifications might you create. So we compiled this list of emails, most of which came from a nonprofit called the QiGong Institute, and they have a listing of QiGong instructors throughout the whole country. And so I didn't know necessarily whether these people would meet our inclusion criteria. And then we got contacts through personal contacts, through web searches, through literature reviews of people who have done research in this field. And so we sent those off, and then we got 58 people to enroll in the study, and then 47 people completed the entire survey. Some people started the survey, but they never finished. So we just analyzed the data for the 47 people. So the response rate was pretty low, but I was happy with that number. These are just some of the demographics of the population. So most people, the average age was 60 years old. It was an even split between men and women. Majority of people were white race, and then 13% Asian. And then the people had an average of 30 years of personal QiGong or Tai Chi practice. And then we asked how people would identify themselves in these various roles, and they could choose more than one. So 90% of the people were identified as QiGong instructors, 73% had a personal QiGong or Tai Chi practice, 54% were Tai Chi instructors, and then 38% were other instructors, 38% were clinicians, 23% were QiGong researchers, and then 8% were MS researchers. And then this shows the distribution of respondents from around the country. So I felt like we had a pretty good representation. California in the green had the most number of respondents. They had 9 people, followed by Florida and then Washington. Okay, so when you ask people like, what would you recommend? Because there are thousands of QiGong forms, we got quite a few recommendations. We got 125 recommendations, including 46 QiGong forms. And a form is sort of a longer choreographed series. They can include like a repetition of various movements, or it can include like a sequence of movements. And so we got 46 of those, 23 Tai Chi forms, and then single movements or practices are or just like a single movement that could be part of a bigger form. Some people said it didn't really matter what Qigong practice you engaged in as long as you met the basic principles. So we identified these principles of Qigong, including intentional movement that was grounded in traditional Chinese medicine theory. So kind of moving the meridians, opening up channels and organ systems. Correct posture and alignment. This focused awareness, rhythmic breathing and movement. And then also it was really important to maintain a relaxed mind and body. So a lot of folks said, if you met all those criteria, then you can do any kind of Qigong. This is just an example. One person says, I don't have a one-size-fits-all approach. MS patients respond better when the nervous system is addressed. So he was even saying you could just do belly breathing, and that could have a great effect on the parasympathetic nervous system. And then also just keeping some flow going is another way to balance the nervous system. We also asked people, like, what are some important qualifications of a Qigong teacher? So the most people felt like, everybody felt it was essential to be able to convey information clearly. That constitutes a good teacher. Also very important was to be caring and compassionate, demonstrate some proficiency in Qigong, and then also have a basic understanding of MS. And then less essential but useful was training, actual training and working with people with MS, and as well as being certified by a Qigong master or an institution. So then we were asked people about this learning environment. So how can a Qigong instructor make people feel comfortable and safe in class? How can they develop confidence in learning Qigong? How do you meet people's individual needs, and how do you motivate people to practice? So being safe and comfortable, part of that was just being physically safe. So having chairs and props, having the right temperature control. People with MS tend to have heat intolerance, so having air conditioning was important. Having access, ADA access to restrooms and to whatever space is being used was important. And then the structure of the class, it was really important that they provide breaks during the class. The class size should be small, and most people felt like it was important to have a class tailored either to people with MS or to people with limited mobility. And then setting clear guidelines around physical and emotional safety, fostering a sense of community and time for socializing. The social aspect was really important. And then also it's including family members and caregivers was considered helpful. And then developing confidence in learning. So regular feedback, being really slow and simple, making sure people stay in their comfort zone and go at their own pace, providing like videos and other learning resources, demonstrating the movements, and lots of repetition and practice. Meeting individuals' needs, sometimes that could be like an assessment, one-on-one feedback and instruction, and providing appropriate modifications like seating things, doing things seated. And then how do you motivate people to practice Qigong? So that peer and family support was highlighted, and then education about some of the benefits of Qigong, inspirational stories, setting goals, and finally just making it fun. Then we asked about the dosage. So average number of people, they said 2 classes per week, 45 minutes each for 12 weeks. If you want to start to see any kind of change in physical changes, 6 weeks if you want to see more mental emotional changes. And then daily practice for 20 minutes, and then 10 people in the class. That was sort of the average recommendation, although the range was pretty broad. this is just one participant wrote this down as if they were speaking to a new student. You are a whole person. The aim is to restore or balance your original mind, body, and spirit. Stay in your comfort zone, have no expectations, and be open to the unknown. And so this just summarizes what our findings were in terms of the goals of the Qigong practice, what should be included, the environment, and then the goals for instruction. All right, so we got all the experts to give their opinions, but what about actual people with MS? We were curious to get their opinions too. And so surely there must be people with MS who practice Qigong and Tai Chi. So the next study was to conduct focus groups of this population. There were 3 people in our survey who also had MS, but were also Qigong instructors. But we wanted to capture the patient perspective a little more. So let's see. So the aims were pretty similar to the other ones, just to understand how people benefit from their Qigong practice, to identify the forms and movements that they felt were beneficial, and other factors related to the learning environment, and then, you know, anything else we needed to do to run a clinical trial. And so this was mostly a qualitative study. We had a tiny quantitative component where we just had asked them complete a short survey that asked about their MS status, their health, and their Qigong practice. And recruited people from all over the US. We were able to send email blasts through the National MS Society and another nonprofit called I Conquer MS, and that was really helpful in finding folks. So our inclusion criteria were adults that had a current Qigong or Tai Chi practice, and they had to practice at least once a week for at least 10 minutes for at least 3 months. And then they had to have an MS diagnosis and be willing to be recorded in a 2-hour Zoom focus group. So this is just some of the information from the survey. It was a pretty short survey. And then for the focus groups, we started out by presenting some ground rules. We wanted to ensure confidentiality, so making sure, you know, people weren't recording any of this, keeping people's names to just their first name. Then we had some introductions, and then we had a set of semi-structured interview questions. And we had given folks the interview questions and the guidelines ahead of time so they could prepare. A lot of people with MS have a hard time remembering things sometimes on the spot. And so everybody felt it was really helpful to have the questions in advance. And again, these are some of the questions. How did you benefit from Qigong or Tai Chi? What are barriers that you experience? What are important things in learning in a class environment, the instructor, advice for new practitioners, and what you would recommend to study in future research. Again, we used reflexive thematic analysis in a software program called Deduce for the qualitative data, which we're finalizing now. So this is coming to the end of, we're in the middle of this analyzing the qualitative data right now. So we had a total of 13 participants. We had 3 focus groups, and people came from 11 different states. So again, it was great representation. These are just some demographics. Average age of participants was 60. 85% were women, which is kind of reflective of MS. About 2/3 of all people with MS are women. Majority of people were white. We had 15% African American, and then smaller numbers of other races. Let's see. And then the disability levels were quite variable. most people had some sort of walking disability, but some people had more severe disability. So when we asked them, like, how has your Qigong or Tai Chi practice affected your health? 80% of people said it helped with their balance. And then 60% said it helped with fatigue and muscle weakness. And then less and less, but it was still interesting to see. About 40% said it helped their mood, their cognition, their walking ability. And then a lesser number talked about pain. And so we had them complete this in a survey, but we also asked them in the focus group as well. And so this was really remarkable, this person's comment. When I started my Tai Chi Qigong class, I was walking with a cane and it looked like I was going to be in a wheelchair and then in bed. That's what was predicted for me. In 3 months, I no longer walked with a cane. In a year, I could take the stairs. In 3 years, I started seeing changes on the MRI. In 5 years, the plaques were disappearing and leaving no scarring. And in 10 years, there's just about nothing left on my brain or spine. It's been incredible. So this person now teaches Qigong. So when we asked about how do you have a successful Qigong or Tai Chi practice, these were some of the themes we came up with. So one really important one was just to really start slowly. A lot of people can be exhausted even after 5 minutes of a beginning class. So really taking it slowly, enjoying and honoring your own journey. This is your practice. Having a consistent practice was really important. During COVID, everything went online and people said they actually practiced more and they started to feel better more because so many things were available online. And then having a really good instructor was also important. And I like this quote. It's a little long, but I'll read it again. I would say it just takes time and everybody's different. And I use the analogy, it's like taking a long road trip that you're going to encounter construction detours, etc. And just just try to stay in the moment with the different challenges and barriers that you may encounter. Don't let it stop you. Just keep going. Listen to your body. Just go inside. Keep listening to your body and loving your body throughout the whole practice. We have a meditation called the Loving Smile Meditation, where we actually go inside and we just smile at each part of our body. And it really helps you forget the pain. So some other things we found for instructors, they said it was really helpful if an instructor provided a lot of encouragement and feedback. The instructors should be aware of the students' level and limitations, provide accommodations and modifications and breaks, and go at an appropriate pace. One respondent was saying, my teacher just goes too fast all the time. So making sure you're not going too fast. Some of the challenges of participating were fatigue. People were just too tired to go to class. Transportation was a big issue. So again, as I mentioned, people attended more when it was online. And then difficulty remembering some of the movements. And then how do you stay motivated? A lot of people talked about having a schedule, like, okay, I do this every day at this time. Accountability, so having a friend or a family member come with you and kind of helps motivate you to participate. And then reminding yourself of the benefits that you'll receive. That's another quote. I'll be honest, there are days where my fatigue wins and I don't feel like practicing, but I have to tell myself, this is medicine. This is medicine. And then one final quote, they say people with MS don't have anything in common, but everybody I've met with MS is very intelligent, and then we have these bodies that sort of betray us. But with the Tai Chi and the Qigong, we can let our bodies forgive us and come back to us and work with us and be partners with us. And our bodies are our friends again, with the Tai Chi and the Qigong. So that's an amazing thing. And so future studies, I'm currently trying to get some more money to continue this research. I'm preparing a career development award through the NIH and also the National MS Society. And so kind of once we have this information from the survey and the focus group, really kind of developing a protocol for Qigong, refining that, testing that for feasibility and acceptability, and then eventually testing it for efficacy. Does it actually help people reduce their symptoms? All right, so I just wanted to thank, so one really wonderful thing about this bridge program is access to these amazing mentors. So Dr. Ryan Bradley and Dr. Heather Zwicky are both incredible. Many of you know them, mentors here at NUNM. Dr. Lindsay Williscroft is a neurologist who specializes in multiple sclerosis and exercise studies at Oregon Health Science University up the hill. And then Gloria Ye is also a medical doctor, and she specializes in Tai Chi and Qigong studies at Harvard Medical School. And then this group of people, those are the fellow Bridge people. So Bridge is a program at NUNM and also in University of Washington. So every quarter we get together and have a retreat where we have guest lectures and do workshops and things. So I wanted to thank that group of folks. It's been really wonderful. And then the National Center for Complementary Integrative Health has been funding this bridge program. So we want to acknowledge them. All right, that is it. So if anyone has any questions, please.
If you have questions, you can use this microphone. Anybody? I have a question. I was really interested to hear the outcomes of kind of the mental, emotional outcomes of this versus the physical improvements. Could you speak any more to that? And could this be used in other chronic conditions as improving quality of life or how chronic pain is experienced?
Yeah, absolutely. And it's kind of silly to like, cut people into their different diagnoses because, really, I feel like Qigong can help everybody, whether you have any kind of chronic condition or not. So yes, absolutely. And the mental emotional part is really, really important. And some people feel like, that's the first thing, at least from the focus groups, they were saying the first thing you experience is this just calming your nervous system, just becoming more calm, more relaxed. And that is actually can help start to heal the physical body as well, because you're reducing this inflammation. And then so the mental emotional thing is considered the first thing that is addressed. And then these more physical symptoms can start to improve. And in the survey, people were saying maybe in 6 weeks, if you have a consistent practice, you could start seeing changes in 6 weeks.
Thank you.
Yeah, thanks.
Did that jog any questions for anybody else? No. Okay. Well, thank you for presenting. This was our last Lunch and Learn of Research Week. Tomorrow is a full day of current research students presenting oral presentations up here, a poster symposium outside, a career. Like to come and support at any point during that, you can stop in when you can. There'll be even better food and more drinks. And yeah, and thank you to Standard Process. They are helping sponsor this event, and there will be a rep outside tomorrow too. So if you want to learn more about Standard Process or try any of their supplements, she'll be there. Yeah.
Great. Thank you, Danielle.